a bit of a less busy month, if you would. But nonetheless, we've still had enough numbers. Just done a bit of a check-in. Those were saying that what they were doing this weekend. If anybody else wants to let us know, do let us know, because we've got a long weekend ahead and it's going to be nice and sunny. Remember to get your sun cream out, Ben, because I feel you. Smash him. So in terms of where we are with hub stats, we have jumped from triple figures down to double figures. We had 70 referrals last month. Again, the national average is still around the 50s in terms of staff members reaching out for support, help and support. And as you can see on the chart that I've started to label it when we hit the hundreds, when we hit the triple figures as well, just so we can see this in terms of data trends at the same time. So in terms of cumulative referrals, we've organised these by employers. And again, it's the big five, if you would, who are gaining traction in terms of numbers. So we've got Merseycare, we've got Luft, we've got Mid Cheshire, and we've also got Alder Hey as well. And then Countess of Chester after that. Then at the bottom end, we've just started tweaking the data. So the data doesn't actually represent the full cumulative approach in terms of aspects such as primary care. Primary care is higher than what it says on the screen, but because we've only tweaked the data recently, it's showing us as lower. The ambulance service is currently on 37. And then we have the police service on 22. We do have some referrals from the fire service as well, but these have been very minimal and they are under the threshold of 10. So we don't tend to share that because it's client identifiable information. So as we move on, we've organised by employer. Again, we usually show the top five, but because they're under 5 in terms of referrals, we can't share that because it's identifiable information. But we can give you this information for your specific organisation. So if you want something for your organisation, do let me know and I can pull this data set for you directly. And if we break it down further, we look at data sets in terms of roles that's available within. So we go from, say, qualified nurses and midwives right down to trainee doctors, consultants, medical students, that sort of stuff at the same time. And the highest number of referrals that we're getting last month was nurses, followed by healthcare assistants on 15. And then, say, a non-clinical support role, so administrator role type of thing, as well as chef, domestic. I've just done a bit of a big push with, say, specific cleaning services for hospitals as well. And they're very open to receiving the help and support. So hopefully we'll start seeing them numbers jump up a little bit. But there is a section on there as other, if people have referred into us and not given a specific job area category, it just gets categorized as other and it falls into the missing category in terms of where we are with numbers. As we go look at the numbers, the stuff that we've done, we've pushed outwards. We've had we've completed assessments for staff members, but then we've pushed these people into more local services or services that suit their needs. So 17 nurses and midwives, 6 doctors and consultants, 3 managers or leads. Non-clinical staff is 20 and other clinical staff is 21. And this month we completed 7 pathway support categories. And pathway support is basically support around housing, debt, finance, addiction, social engagement. So these are the people that have come through the hub. We've done their assessment, but we can't provide their needs. So we've passed them to more local partners within the local areas. And these will be the patients that we pass on forward, or clients, I should say, don't get passed from pillar to post. We organise everything on their behalf. So it's a streamlined process. That essentially is where we are with the numbers. We do have some hub updates in terms of what's currently happening at the hub. I have previously sent out an email to everybody, and I've just not put it on this because we record it. But the team support section of the hub has now paused, and this has been taken off the website. This is to allow us to catch up with referral numbers. our referral rates are currently at a 5 week wait. So we're alleviating the staff members taking pressures from the systemic team and actually put them towards the more assessments. So assessments will be coming down and we can offer more assessment slots to clients coming into the hub. In terms of where we are with everything else, the sleep group, what we currently had running previously, well, I'll start with the virtual wellbeing week. So last week was Mental Health Awareness Week, and during that time, we also ran a virtual wellbeing week session, and we did lots of things on around team care, team care, self care for individuals, burnout, sleep hygiene, breaking down barriers to mental health services, and also things like cost of living support, which went down really well. So following that, we ended the sleep group that we started in January, because what we found was the referrals coming into the hub just wanted an assessment. They didn't want that sort of group approach. So we've tailored that and actually created a new CBT skills group, which is effectively an all-rounder. It touches on things like sleep hygiene. So instead of just focusing on one, it's a group effect focusing on CBT skills. We're currently in the process. This went to our governance meeting last week and was signed off. It's currently in the process of getting signed off and put online. But we're also changing the way we do it, and we're going to make it into a workshop. So instead of people having to refer into the hub, to have an assessment to then attend a group, we're making it easier for people. And we're making a more psycho-educational approach to this, so it's available to everybody. This will be recorded and also will be put on the website and also the YouTube channel as well. With that, we've also stopped active outreach, like direct outreach. We've not stopped it, we've slowed it down. We've just moved it to a more digital approach at the moment. And part of that is us still doing stuff, but wanted to recognise staff members as well. So we've created a staff recognition scheme called the Shining Stars, and I asked you guys names, that sort of stuff. A few of you come through with some good ones. So we settled on the Shining Stars. However, I did have to have a meeting with Merseycare Comms about this because it was kind of like a copyright aspect from Merseycare. Understandable. However, we've had 150 nominations, and what's going to happen, it's not like an award ceremony or anything like that. We have 33 critical care wellbeing bags, and these have swanky stuff in, like colouring books, heat packs, candles, that sort of stuff. So instead of these just sitting there collecting dust, we're going to distribute these to people who get awarded. But like I said, we've had 150 nominations, so we don't want to give to some and not to others. So we're putting other packs together in terms of wellbeing stuff, basically what we have for outreach at the same time. In terms of workshops, these are all filmed and now hosted online. So if staff members can't attend our workshops, they can just watch it. Or if you've got a staff session, you can run it via YouTube, play it, that sort of stuff. And we've brought back the burnout workshop because what we found from the NHS staff survey results is that staff members are still feeling burnt out. So we've brought this back. This is going to be tailored and also be hosted on the website and the YouTube at the same time. Again, the website is being edited constantly. We were brought together because of COVID and on paper and in inverted commas. COVID's finished. We're not stressed out. We're not burnt out. Everything should be fine. However, we're here to help with staff mental health, that sort of stuff. So we're editing the website to be less COVID heavy and be more information based so people can get their own insights. So way ahead of time, I reckon. But we'll go over to partner updates. Does anybody want to kick us off? And at this point, I will stop presenting so I can see your faces. Go on, Ben, I'll go to you.
I was going to say, I'll go. Sounds okay. So really quickly for me, a bit of a whistle stop tour. It's been a while since I've come on. I'm just going to do a bit of a report or an update in two parts. So in terms of our delivery, something that we have started more recently, and it probably fits in with the kind of the the extraction of your one, Lee, as we started the sleep session, in the recognition that we're getting a lot of staff who present to our psychological therapy services with sleep issues or inability to sleep. We've started to do some group work now in that space. We're going to kind of suck it and see how it goes in terms of numbers and the impact, with the view that we'll kind of then review frequency, will increase if we need to, etc. But recognition that there's definitely a need for that, and we're going to interrogate the data, something I'll talk about afterwards a little bit more in terms of what that could look like for the future. We've mobilised a weight management group, and around food, nutrition, weight management. This is an online session. I think it's over a 6-week program, with a view that there's a lot of coaching in there. There's a lot of dietary support. There's a lot of measuring that goes on within the progress of the 6 weeks as well, so people can see if there's any improvements. We've revamped our resilience programs. We've now got 2 different types of approach to it. We've got a 2-hour session called Drains and Radiators, and then another half an hour bite size called Riding the Waves, or maybe it's the way around, with the names, with a view that we just wanted to steer away from the word resilience. From feedback from staff, they were talking about it can sound quite insulting based on how resilient they've been over the past few years, and I think there's absolutely a point to be heard there, and I think we've got to make sure that we're listening to them. And finally, we're increasing our menopause offer. Lots going on nationally in this space at the moment. I've been part of a policy development group nationally around how we're supporting people within the NHS in this space. I'm potentially getting some more investment from our charitable funds, which I'll talk about now. For more of a strategic angle at the moment, we are undertaking a health needs assessment for the organisation. Now, we've done a health needs assessment twice since I've been in Merseycare, once in 2017, once in 2021. We look at all of a lot of data from across different kind of areas within the trust, whether that be occupational health, whether that be HR, whether it be, health and safety. But ultimately, as well, there's a big engagement diagnostic here where we're getting in touch with staff to ask them about their mental, physical, environmental, and more recently, financial and social needs, based on the fact that what's going on with cost of living, post-COVID, that feeling of belonging, trying to link in with the National Women's Strategy around connecting, etc. So there's going to be a big diagnostic going out with staff, fingers crossed by the end of June, which will really help kind of inform of what our strategy and our kind of new approach needs to be. Because I think, whilst I believe that we've done well in Merseycare, I think that we've been a little bit haphazard in how we've responded, and that's simply because we haven't had that stability within the organisation, nor our service. I think we've been very much firefighting and reactive, and we want to get into a point now where we are being proactive and getting ahead of the curve. And it's nice now that we've got our facilitators within our team in place to be able to kind of go out and really, really have that visibility within our divisions, that integrated model. Finally, within Merseycare, we've now there's been a kind of a mobilisation of a charitable funds service, which I'm aware every other organisation has had for some time. Part of these funds can be used for health and wellbeing intervention. So I've put a proposal through around 4 to 5 different projects. I'm not at liberty to say what they are yet, but they're quite innovative, they're quite out there, which is great. And pending sign off, I'll be happy to update everybody about what that looks like and how it goes. And that's it for me.
Well, it's very insightful in terms of, I always like coming to you to understand what's currently happening, because you've got fingers in many pies, and it's that Scouse accent essentially where you're like, right, we're getting this, we're doing that, and I'm like, okay, I want to do that.
Lee, I think I talk posh and slow.
No, I think no, it's that charm, that Scouse charm.
You know what? I can absolutely talk posh and slow should I need to.
Hey, I'll get you involved in our comments videos then.
I just get excited.
Well, thanks.
Nice
Ben.
one. Thank you.
It's really insightful in terms about the charitable status stuff as well. So when you do get a sign off, because I know what it's like jumping through hoops, let us know.
Yeah.
And we'll share that information around as well.
Absolutely.
Well, thanks, Ben.
Thanks, Liz.
Kate, I'll come off to you.
I feel very underprepared after Ben's information, so I'll keep it short and sweet.
It was literally a post-it note while he was talking.
I love it. I've just been sat listening, and I think it would be really exciting to hear about what those projects are once you can share that with us all. So yeah, I'm going to keep mine very short and sweet. As you know or may not know, I'll give myself a quick introduction as well, because I have missed a couple of these meetings. So my name is Kate Moss, and I'm the Staff Wellbeing and Engagement Manager for North West Ambulatory ambulance service. I'm still fairly new to post, started in December. I'm going to keep riding that until this December, I think. So I'm still just finding my feet within the organisation. We've had some exciting news in the last couple of weeks that we've managed to get some funding to secure some extra staff members for our wellbeing team. So that's really exciting because currently it's just been me since I've been in post. So it'd be great to have some extra support and all these ideas that I'm either listening to other people and thinking, oh, we could use that in our organisation, actually being able to put some of that into place. But yeah, that's about it. Very short and sweet. Yeah, I'll try and make sure that I have a proper update next time we're on one of these meetings, and I'll come prepared for you. Yeah, it's great to be on here as well. Thank you.
Thanks, Kate. It's funny when I start talking, because you can use to see people just scrambling, like, this is what we're doing, this is what we're doing. It's just like a quick, just a quick whistle stop tour in terms of what we're currently up to. So don't worry about it. It's one of them where we just like to share information and like give idea sharing. So you could tap in with Ben, or you could tap in with Philippa type of stuff to understand what projects or how they ran it at their organisation. Brill, thanks, Kate. Kathy, I'll come to you.
Thanks for not coming to me after Ben as well. No, just a few updates from me. We had a really, really good day on Wear It Green for Mental Health Week last week. Going around the hospital, lots of the staff wore something green, took some great pictures. So it was really nice to see people enjoying something and taking part in it, taking selfies of them all in green. We're still in the process of doing our wellbeing hub when that eventually comes. It should be August. I've been in Ellesmere Port Hospital all day today because we've been having meetings around the area in Ellesmere Port, which is quite dire. It's really dire, and it doesn't really show the staff how much we value them or care for them when we've got an area for them that looks like this. So we're really trying to focus on doing something for Ellesmere Port, who always feel a little bit like the second cousin to Chester. So doing a bit of focus on that.
Brill. If you need any help or support, let us know, because I know when we come and did the outreach event there, and we said if there's anything that we can do for you, then let us know.
Lovely, thanks, Lee.
Brill. Nicola, I'll come over to you.
Hiya, I'm Nikki Murphy and I work for Aintree Primary Care Network, so I'm probably one of the only people representing primary care at the moment. So it's all very new to us, the staff health and wellbeing, but it's something I'm really passionate about because, you know, with staff retention and we just need to care for one another. So we're starting at the beginning and we're trying to build relationships with our staff. So I cover 4 GP practices. I'm a lead care coordinator, so we're going to do a staff health and wellbeing day on the 29th of June, and it's basically getting it's for the admin staff and the reception staff, because that's what we've got funding for at the moment, and they're our priority because as we know, the receptionists do really take a bashing on the phones and everything, so they are under a lot of stress. So yeah, we're just getting everyone together really as a starting point, and we do want to do a staff survey to understand what the needs are and what the issues are, and then what support we can implement then as a regular intervention. So that's where we're up to at the moment. So any support is very much appreciated.
Nicola and everybody else, sorry to interrupt there, Lee. I'm very, very happy to send our health needs assessments, which is basically the diagnostic that you're after. I'm just putting it through our kind of due diligence and sign-off process. But once that's done, I'm more than happy to share, because, you know, we're all NHS staff here and it saves you guys doing it.
That'd be amazing.
Okay, no problem.
Oh, thank you.
Thanks, Ben. Nicola, are you part of the Futures programme, the PCM Futures online?
Yeah.
Right, because I'm gonna say I was catching up with all of the information from that as well, and there's some really good, like Ben's just said there, like diagnostic stuff available. But if Ben's got that, happily send it over. But if there's anything from us, I
What
know you've emailed.
platform is that on then? Because there's all different workspaces, isn't there? So
Yeah,
sometimes you go on, it's a bit of a minefield. I'm in that many workspaces.
it's just the direct PCN one. I'll get the link and I'll send
Okay.
it you.
Okay.
Because I was having a good nose in. There's also a newsletter. I can't remember who does it, but there's a PCN newsletter come from the national team as well, and I get them, and it's really insightful to understand because certain PCNs are way ahead in terms of, say, staff wellbeing. So a lot of them contribute in terms of we've done this because we've got all this results type of stuff. So I'll get them when it comes through. I can't remember who sends it to me, but when it comes through, I'll forward it to you.
Okay.
I don't know whether you might get it or you might not, but it might be helpful for you.
Yeah, that'd be great. Thank you.
Well, thank you very much. And if anybody else has any other insights that they can help the PCNs or with any sort of procedural aspects, please do send it through and we can send the information over, or you can contact Nikki directly. Just in the chat, Ben, Paul from the ICB would like to get a copy as well.
Thanks. Yeah.
Smashing.
Once it's finalised, I'll update everybody on here, and then those who want it, I can share it directly with. Hopefully, like I say, that'll be next month.
Smashing. Thanks, Ben. Appreciate that.
No problem.
Philippa, over to you.
Oh, hello, everybody. So just a very, very quick update from me as well in terms of what we're doing at CCC. So we're actually sort of replanning at the moment. So just sort of, reviewing our plans and sort of defining what our offer is. And that's really in line with our workforce and OD strategy as well. So again, at the same time, we're sort of reviewing implementation plans for the next 12 months. So it fits into that really. So I think what we've found is, and I think, this has been mentioned already on the call, I think we've put so much information out there during COVID in terms of support and just in terms of our sort of intranet sites all got a little bit busy, and I think staff are sort of maybe a little bit too much information, and staff maybe are a little bit confused by what our actual offer is. So we want to sort of strip that back a little bit really, and we've identified sort of 4 key areas for wellbeing and engagement. So healthy culture, healthy mind, healthy body, and healthy lifestyle. So we're just sort of defining what our plans are going to be sort of under those key headings really, and in terms of the information that we have on our intranet, they'll be under there. So it's really a case of sort of planning, redefining, and then being very clear with staff in terms of what our offer is. So that's sort of the phase we're in at the moment. But just in terms of some of the things that we've done this year, so again, we've been trying to sort of focus on some sort of key health and wellbeing sort of events. So we've done a couple of step challenges. So for walking month in May, we launched a step challenge. For our staff, we've done so in April. We did some sort of resilience trainings, mental health awareness training sessions. We're also as well just about to sort of put out some expressions of interest for wellbeing and engagement champions. So we want to bring that group of people together and do, form that group and do some development with that group as well. And then later in the year, we're also planning to do some Live Well, Work Well events where staff can come and get sort of their health checks and get some advice and guidance on sort of healthy living. But as I say, I think once we've pulled together our plans, we will then define a little bit more about sort of other activities for the next sort of 12, 18 months.
Well, thanks, Philippa. So it's quite intense when you're doing strategies at the same time, trying to understand where you go and take the direction at the same time. So if there's any support, that we can offer, let us know as well. We have been in contact with, is it Robert Jones? Is it Elm House? I don't know if that's the cancer centre or not. But they was contacting us in terms of like strategy aspects as well to see if there's any support that we can offer. So if there's anything for you guys at the same aspect, let us know and we can help that way as well.
Yeah, no, that would be great. Thank you, Lee. Thanks.
Well, Kathy, you've got your hand up.
Just something that Philippa said there with regards to the wellbeing champions. I wondered if anybody's had any success with that kind of thing. We've got quite a few wellbeing allies. 50 of them I recruited from when I first started. And unfortunately, you lose track of them. They sort of drift off, and they collected a badge and they loved the badge, and then I don't see them no more. I wondered if anybody's got any success stories with their allies and champions, how it works, what works, anything like that.
No. I think certainly from my experience, people do it for the lanyards, and it doesn't
Yeah.
feel like a very active, visible role. And there's something about champion and advocate dilution and fatigue because there's that many. It is something that we're looking at. I've created a role descriptor and the likes of, and now because I've got health and wellbeing facilitators in each division, they're going to be coordinating the work plan for them. But it needs to absolutely be spelt out and managed and coordinated from a centralized place within a division, as opposed to everyone just going off and doing what they want. So yeah, I feel like moving forward, I want this to be something in job descriptions when we're going out. To be able to say we want 1 in every 20 staff to be a health and wellbeing advocate, but this is the expectation. Just so that we're saying it from when people go come into the organisation. But ultimately, from experience, I know that some of the barriers here aren't about the staff member and the willingness. It's about the manager releasing them and giving them time to be able to operationalise some of what we're asking them to do.
Yeah, I agree with that. I have my boss's boss is constantly saying, because there's only me in wellbeing here for the wellbeing of the staff, and I'm constantly being asked, well, what are your allies doing? Where are your allies? Well, the allies are absolutely busy as understaffed, overworked.
The NHS national team have some training. I've recently put it on our website. I'll send a link across. They have some wellbeing champion training that staff can actually get involved with and actually learn to develop from as well. I'll send that across in the minutes once we send that across.
Kathy, part of the agreement that I'm working up is that managers will release staff for 1 day per month before they express an interest, just so they've got ring fence time to support the agenda. Otherwise, it just feels tokenistic. You could have 500 champions, but it means nothing if they're not doing anything.
I also do the mental health first aid training and a lot of that. I mean, it's fantastic. It is a fantastic course for people, but they tend to sort of do it, and then that's it. They're not an actual mental health first aider within departments anywhere. So it's not going in that way.
Ben, quick question. In terms of when you say you're getting people signed off, like ring fence time, is that signed off by, say, a sponsor, a group sponsor, or
it'd be by the manager?
Right. Okay.
So in order for them to express an interest and come forward to be an advocate, they'll need that release from the service by the manager beforehand. Again, where it's been here historically, Lee, you've got a lot of people saying, yeah, that sounds good, I want to do it. But the impact or the pressure on core business doesn't allow it. So they're just sitting there with a kind of a different lanyard on and not doing anything with it. So it's about, if you're coming forward with this, if it's something that you want to do, I want authorization from your manager. I want them to understand what responsibilities there are in your role and the amount of time it's going to take for you to commit per month in order to do this.
Yeah.
Perfect. It's just about managing them expectations from the offset, isn't it? I hate the idea of it not being an active role.
I think because when we talk about, say, wellbeing champions, we've got champions at the hub, and what our champions do is liaise with like the likes of your staff members, for example, to find out where we are with waiting list. And this was something that we found, is that it was very much hitting our head against the wall because we couldn't get past the managerial aspect, trying to find certain information. So it's like creating partnerships and linking with people at the same time to get that information. Kathy, I'll have a look to see through our procedures and see if there's anything beneficial that we could support you with there. Well, thank you. Smashing. Then last but not least, I'll go over to you, Paul, from the ICB.
Hi, good afternoon. I think as Paul Martin, I'm head of workforce programs. I think I mentioned at the last meeting, similar to Nicola, we're kind of still in our infancy in a way. But since the last meeting, my colleague Suzanne Burridge, who I'd have to credit with all this hard work over the last month or so, has made some great progress. She had the first partnership engagement forum couple of weeks ago. So the ICB brings together 9 different places. So that was a brand new group. And one of the big things kind of coming out of it was things like people's sense of identity and belonging. And we're still trying to kind of create that cohesiveness within the organization. I'm sure anyone in the group who's been through any of these organizational changes where you're bringing staff in from other areas, it brings all different sets of challenges and issues with it. After an initial stage, I think it went pretty well from what Suzanne was telling me, and kind of give us a few things to focus on. And what that led us to do was at the recent town hall, Suzanne and our EDI lead, Thomasina Affle, we did a session with all of the staff. So there was about 500 staff. We employ about 1,000. We're quite a small organisation, but about 50% of the staff attended. And we did an interactive Mentimeter session looking at the types of groups, not only for engagement, but the types of well-being initiatives as well to come out. So funny enough, we were just this morning running through some of the data that came back for that. But hopefully that in itself is just getting that message across to the staff that somebody cares. We're having so many different locations. It's much harder than my experience of working in maybe a single site where I've done before, where it's easier to reach out and get out to people and meet face to face. Whilst we get the efficiency of teams, sometimes that connection's lost. So Suzanne's been getting out and about and meeting with people and just doing quite a lot of talking at the moment. So I certainly feel Nicola's pain in terms of that startup feel around it, but progress being made, and these groups have been really helpful. And hopefully over the next few months, we'll be able to share some of that learning that we've learned and obviously learn from the group here.
Well, thanks, Paul. When you say you guys have just done, say, a partnership engagement aspect, is that just your staff, as in the place staff, or is it like staff across, say, Merseycare or East
No,
Cheshire?
just within the places. It's just
Right,
an
okay.
internal facing within the ICB. Yeah.
Right, because I was just going to say, if needs, we could collaborate this meeting as one, but if it's a separate entity, then that would just...
Yeah, I think we've still got quite a bit of work to do, to be honest. The ICB's coming up to its first birthday in July. We're still finalising structures, gaining our identity, and it feels a lot like a startup in a lot of ways.
Yeah.
So yeah, it's still a lot to do, but again, thanks for everyone, for their input in this meeting, because it is invaluable to us.
Well, no worries. Well, thank you very much. Really, really insightful. And if there's anything that we can do, like you said, Ben, you'd like a copy of Ben's aspects that he's putting through, that's going through sign off at the moment. If there's anything we can support you with like that, do let us know, because we know exactly, coming from COVID, we was all reactionary. We're now trying to take a step back, and Ben mentioned something the other meeting last month or the month before. Instead of rescuing people that have fallen in the stream, why we're not going further upstream to understand why people are falling in the stream in the first place.
Yeah.
I think that's where our strategic direction has gone, in terms of becoming less reactionary and more active support for people. We ran a big session the other day on the cost of living. And I put everything in this presentation. It is on the website, and I'll put the link in the minutes as well. They're really insightful. Basically, you just click the logo, it takes you direct to that page. And we've had so much feedback from people about that, because a lot of people say they get confused. There's so many offers with the cost of living stuff, for example, that it's good to just have it in one place. Brill. So that brings us to the next bit, which is just open floor. I haven't actually put a theme in for this month, because I just wanted to see if you guys had any queries, questions, or just wanted to ask for help or support from other partners. I know that we don't have a lot of partners here today. We do. Oh, I do have an update, sorry, from Jude. Bear with me. Jude Heaver at the the Northwest team. She's one of the mental health leads. She just said she's really sorry she can't attend this meeting this afternoon. They've got a lot of stuff going on. and they're also planning for the first face-to-face event on the 21st. So they're having a bit of a get-together, which will focus on the people promise themes. And this will be on the 21st of June. And the newsletter will be out early next week, and it will provide registration details for the event. And this will be at Bolton Stadium Hotel. So people in the Health and Wellbeing Leads in the Northwest are invited to that. So if you don't receive that email or you're not on that list, let me know and I can forward you that on. Or once it comes through, I can put it in the minutes once we've got it complete. It'd be really insightful and actually good to meet you all face to face, because I know we've only ever done Teams meetings. So if you are going, then the information will be there to sign up. Yeah, Kate, I will share that with you as well. I'll put it in the minutes when it comes through. I'll also introduce you. I don't know if I've introduced you before or not, but if I haven't, I'll introduce you to Jude, because it'd be great to touch base with NWAS and also the Northwest team. Smashing. That brings us on to open floor issues then, or just any queries or questions. Like I said, I haven't put a theme in for this month because I just wanted to touch base with you guys to see if you guys need any help or support, or if everything's going all right at your side. Go on then, Nicola. I keep calling you Nicola, but you introduce yourself as Nikki. So
yeah. I'll have to
Nicola?
change that on my Teams. Just to see if, we're having this health and wellbeing event, so we're just looking for a location at the moment, but we're nearly there in that sense. Would one of your team come along, because I do share a lot of information from the hub, and I just think if to have someone there, to have a chat to, even if it's just for half an hour, there's going to be approximately 60 staff there, just to meet face to face with someone and understand the offers. Do you know what I mean? Would that be a possibility, or are you spread very thinly?
I've got to be careful what I'm saying. However, the answer is no.
Right, okay.
Purely because we are currently between a rock and a hard place at the moment with our funding.
Okay.
We don't know whether the funding's been confirmed or not, so we have to start streamlining in terms of the things that we do. So active outreach at the moment has been postponed.
Right.
It's moved to a more digital approach. I can attend a Teams meeting, I can do a presentation, but unfortunately, we've not had our wings clipped, if you would, but we have to streamline in terms of resources, purely because of that. I don't know any information that I could share with you about where we are. I'm not privy to these meetings, but once we do get an update, I will be contacting just to let you know exactly where we are, what we're doing, type of thing.
Okay.
So it might change, but at the moment it's going to have to be a no. I do have some goodies, and I'm looking at the pile. It's not much. I do have some goodies that I could give you, but unfortunately we can't attend on the date itself.
Okay. Thank you.
All right. Sorry.
No,
Really
it's
bad.
because of last time when we did the care coordinator event, that was
Yeah.
accepted really well, and it just got people talking about it, and which was amazing. And I mean, we all get information through, and sometimes it's just not having the time to
Yeah.
read it when someone's presenting it to you, and
Yeah.
you're listening. And you're having the conversation face to face. It does make it's got much better impact, hasn't it? But
Yeah.
I understand.
I will keep you
I've-
updated.
I've-
Sorry, go on, Ben.
Thank
Nick,
you.
I've Nikki, sorry, I do different work as part of the consultancy for Mersey Care with different PCNs in terms of these types of days. Do you want to stay on the call afterwards and I'll have a little chat
Yeah,
around what it
great.
could look like? Okay, all right.
Okay, thank you.
Ben, I'm going to be that person though, and just say, Nick's put her details in the chat. Will you just give her a ring?
Yes, sure.
Purely because the recording will pick up everything that you're talking about, if that makes sense.
I love you, Lee. Thank you for letting me know.
Sorry.
No, it's great. Thank you.
But yeah, so unfortunately, I'd love to, but I can't. But if I'll have a look through the rest of my goodies. If I can give you some of them, I will. But I will let you know if that changes as well.
Thanks very
Brill.
much.
Any other queries or questions? Ben, is that a legacy hand or is it a new hand?
It's old, decrepit hand. It's going down.
Smashing, no worries. Any other queries or questions? Or would anybody like any support with things? Speak now or forever hold your peace. Go on, Philippa, over to you.
Yeah. So, well, just relating to what I was saying about sort of our sort of planning, what I do need to do is create something very visual, a plan on a page. So if anyone's got anything just in terms of, to help with my creativity, just in terms of, a nice summary of what you do, plan on the page, then I'd be more than grateful just to have a little look at it.
I think we have something somewhere from when I first started at the hub. It was like when you get a new job, you want to put your stamp on things. So I will dig through my engagement folder and see what I can find for you. I can't promise anything too good, if that
Yeah.
makes sense.
Oh yeah, no, you are very creatively. So yeah, no, anything, just have a little look really, just for some examples. So that's what, yeah, I'm looking to sort of pull together really.
Well,
Thank you.
I'll have a look at that. Kate has just put in the chat, it'd be good to hear about your wellbeing events as they're looking to do the similar and be also interested in a plan on a page, and she's just putting details in the chat. I'll also put this in the minutes, so if other people have insights that they can share as well, but I'll put your email addresses on the minutes as well, if that's okay with everybody. Brill. Well, if there's nothing else, that's it.
Great.
Short and
Thanks.
sweet. Thank you very
Thanks,
much.
everyone.
Have yourself
Cheers.
a lovely long weekend, and especially in the sun.
Indeed.